Hi, I'm Simone from Play with Food.
Hi, I'm Kim from Citadel First Aid.
Today we're going to be talking to you about the feeding continuum and some concerns that parents might have about choking with their infants. So when you said about starting solids with your children, there's lots of different opinions and advice out there. Our aim today is just to tell you a little bit about the strategies, the facts, and what you can choose for yourself that suits your child. Feeding your children can be highly emotive, and it's definitely not part of our aim today to give you advice that you feel like you need to take on board. Okay. So when we talk about the feeding continuum, we talk about what happens with children over the time that they're eating from 0 to 24 months. So talking from their very first foods, breast or bottle feeds, through to when they're finally refining their skills at being able to eat at the table with their parents. So it's a really long journey for the first 2 years. It's not just about that very first, do you go puree or do you go with the lamb chop and do the baby-led weaning thing. So what I'd like to talk to Kim about first of all is what sort of concerns do you think parents might have about feeding their children?
Well, going into solid foods at a young age is quite difficult for some parents. They're not quite sure whether they should ease them into it or if they should, just do the drastic into solid foods.
Yeah.
And knowing how big a piece of food to give you.
Sort of things that would be the difference between choking and gagging.
Okay, so with choking it's a little bit different. You will see that they're quite struggling to breathe. Maybe even the horrible situation where they might not even be able to breathe at all, which would be pretty serious. Gagging is just a automatic reaction of the body when maybe possibly they don't like the texture of the food. Maybe it's a bit too lumpy for them and they're not quite up to that standard yet. So it's very different. So they're quite breathing quite normally with gagging, whereas choking, they may be struggling to breathe.
So ultimately, from a first aid perspective, gagging is actually something that's not to be a concern?
No, it's not a concern at all, and it's not a medical emergency in any way.
Okay. And with choking, are you likely to hear a lot of noise?
Sometimes yes, sometimes they might be coughing a lot, particularly with toddlers.
Mm-hmm.
The younger they are, the less noise they will make.
Okay.
So because they've got very small breathing tubes when they're quite young, that is a concern because it might be a very silent choking, which makes us very aware we have to be observant parents as well.
So we highly recommend supervising
Absolutely,
children at all times while they're eating.
Yeah. How many times does mum get distracted to answer a phone call?
Yeah.
And things happen with children so quickly.
Yeah. With what I've experienced from a feeding therapy background, it's really important to make sure that that gag reflex is something that we train with children so that they're not gagging when things are right at the front of their mouth. The best way to train a gag reflex is actually to have things going in the mouth that cause gagging potentially. So by reducing that sensitivity to gagging, by allowing it to happen ever so slowly and under supervised conditions, you can help train that gag reflex to move further and further back in the child's mouth.
Definitely. And it also comes into its moment when they start cleaning their teeth as well.
Yeah.
Putting that toothbrush in their mouth is very foreign to them.
Yeah.
So these are the types of things we need to think about when kids are going into that toddler stage from the baby stage.
Mm-hmm. So one thing that the developmental food continuum that was developed by Dr. Katie Toomey out of the US, it has really helped me to find what sort of things you could be doing in parallel. So you could have your soft mashable foods for your children with table foods from sort of early on, even as early as 6 months sort of thing. Your hard munchables can then be had at the same time, and your hard munchables are there to help the babies get used to having things in their mouth. The objective of the hard munchable is not actually to eat it, or chew on it. In fact, you would rather the child not to be chewing on it and just getting some play with those hard munchables in their mouth to help move that gag reflex. After that, we move to things like meltable hard solids, and they're the things where you put them in your mouth and with one bite, it basically disintegrates. Unfortunately for us in Australia, that often does mean maybe an unhealthy food, but there are a couple of foods out there, if you look around, that you can do or you can make yourself that cater for that function.